Hello, welcome back to lecture. For this week, we're going to have two chapters that are quite a bit shorter than the ones that we've had recently, just a bit more focused topics. And the one for this is chapter 12, Pacemakers and Implantable Cardioverter-Defibrillators. So, kind of sticking with cardiovascular, of course, in this section. So let's get right into it. Okay, so um, just how to understand what a permanent pacemaker even is. So it improves symptoms associated with atrioventricular synchronization and and inotropic or chronotropic issues. Man, that came out of nowhere. So there's two components to a permanent pacemaker. So you've got a pulse generator and then either one or two pacing wires. And the whole goal for these pacing wires is to sense the wire detecting a sensing wire detecting electrical signals and then a pacing wire. So the whole goal is to basically, make that SA node, I guess, work better because in this population, it's not working at a normal rhythm. So the book has quite a bit more details about how pacemakers work if you are curious, but it's not really in the scope of this class. So we just have this pretty basic slide. Yeah, just describing what a permanent pacemaker is. Now, what is our scope is stuff like management and medications. Um, so obviously, this population doesn't take medication specifically for a pacemaker. A lot of it is determined by the comorbidities or physical conditions that they have underlying the heart condition that led them to get a pacemaker, right? So a lot of the common medications that they'll be taking are things that we've seen before. Things for high blood pressure or for chronic heart disease or chronic heart failure or, hypertension, whatever it may be. So stuff like ACE inhibitors, beta adrenergic blockers, calcium channel blockers, and in general vasodilators to decrease the resistance of blood moving through the different arteries and veins. So yeah, if you are curious about what each individual medication does, then we have gone through them in the past. So look back on your notes. So continuing with that, I thought this was pretty interesting to share with everyone. So, cardiologists or the people that work with these populations who have pacemakers use a radio frequency machine and it assesses the stored data from the pacemaker about the individual's heart rate and their heart rhythm. And then they also can program a device to minimize symptoms that are, again, very individualized for each person. And the four main goals. Um, for this whole process is first sensing the native heart rhythms, including the changes during exercise. Two, responding to prolonged pauses or tachycardias. Three, successfully stimulating the heart chambers to contract. And four, successfully terminating life-threatening rhythms. So I thought this was pretty cool. The little pacemaker keeps all of this information, and the doctors work with the individuals to program devices to their needs. I think that's really awesome. Says a lot about where we've gotten in the past several decades with all this technology. So, how does a pacemaker impact someone's exercise response? Well, overall, the benefits of exercise are pretty similar to those of other populations, and I will list what those improvements are. And this is likely due to the fact that, this population probably have those comorbidities that we've already talked about, right? Stuff like I mentioned, hypertension, dyslipidemia, chronic heart failure, so on and so forth. Um, so patients with the pacemaker should understand the symptoms that might come about by an inappropriate heart rate response to a new activity. So we'll go over this a little bit more in the exercise training considerations, but yeah, there isn't anything like super specific about an exercise response, but just to be thorough, I will mention some of them for permanent pacemakers and then the ICDs. So for permanent pacemakers, these generally improve exercise tolerance because they do a plethora of things that were not present in the person before, right? Um, and there's various physiological sensors like accelerometers, vibration sensors, and ventilation sensors that help increase the pacing rate during periods of increased physical activity. So this is great, and this is really positive. However, It is an algorithm, and the response of it can vary. So maybe for one individual, it'll match really well for what they're wanting to do with exercise, and for some people it may not, or it may differ based on the modality of what they're doing. So some discrepancies have been noted for things like climbing or descending stairs, walking at an incline, and exercising on a stationary cycle. So I don't know enough about pacemakers to say this, but hopefully that's the point of the cardiologist with that machine. You know, they assess the data on the pacemaker and can help to match the individual's goals to what the pacemaker is doing. So just note that it shouldn't be a real concern compared to a lot of other problems that we've talked about throughout this course. But yeah, just something to note. Now, in terms of ICDs, these are implantable cardioverter defibrillators. So, again, the book has some information about how these actually work. But for the scope of our class, the main thing that you need to know is that the person, you wouldn't even know that they have this, um, other than the fact that if they are having a life-threatening emergency, like a dysrhythmia or something, then that delivers a shock to them. Otherwise, it doesn't do much. It's still a permanent type of pacemaker, but yeah, it works a little different than the permanent pacemakers that we talked about. So they'll only get a shock when they have a life-threatening dysrhythmia. So in essence, this shouldn't have any effect on exercise response, in theory, right? Now, unfortunately, even though this is great technology, sometimes inappropriate shocks occur, and it occurs in about 15% of people who have an ICD. And what we mean by inappropriate shock here is basically when they have normal sinus rhythm, everything's fine, and then it delivers a shock. So could be for a variety of reasons, but what you should know as the trainer, coach, um, exercise physiologist is one, these shocks are not shown to be greater in those who participate in moderate intensity exercise, so it's not exactly related to intensity. But you should know that people can get a little put off by an inappropriate shock. I mean, it could be kind of scary. They might think something is happening when actually it isn't. So just note that if you are working with someone who has an ICD and maybe has either experienced an inappropriate shock or it happens during a training session, just know that they may not want to push the intensity any further, even though we know that it is safe to do so. So that's just a little note, a little practical note. Okay, so we talked about how the effects of exercise training are very similar to other conditions that we've talked about throughout this course. But in case you want a reminder, they can have increased exercise capacity, reduced risk of mortality, improved cardiometabolic risk factors, reduced depression, and improved quality of life. So we have covered all of these. And again, they're likely the same benefits because they probably have those conditions as well. And a key point about working with this population is that their underlying comorbidities and health problems are probably more dangerous to them than just having a pacemaker or having an ICD implanted in them. Um, and it was likely the reason for the implantation in the first place. So focusing on those is probably the way to go with this population. So exercise testing, every group, every population that we talked about, we talk about is it appropriate to do an exercise test? Sometimes it is, sometimes it isn't, depending on the person. But here it actually can be quite helpful because it can assist in evaluating the rate response of pacemakers and establishing the upper heart rate limit. So yeah, it probably is a positive thing to do for this population. Now, some considerations that you should take when thinking of how you should do this exercise test, it should be based on functional status and goal. Um, so I think this is relatively straightforward. We've talked about some populations that um, are still high functioning, some of them that aren't. So if there's conditions such as frailty associated or chronic heart failure, maybe rethink it. So it really does depend on their functional status. Um, but if it's someone who's healthy and just had something happen with their heart and now they need a pacemaker, then yeah, testing should be fine, right? So just assess that status and their goal. Their medication should be taken at least 3 hours before testing. Determine the upper limit before testing. And a note about just the readability of the results, pacemakers specifically, not ICDs, limit the utility of a test due to reduced sensitivity to detect repolarization. So if you're looking for stuff like myocardial ischemia, it's going to be a little bit more difficult because the pacemaker, yeah, it just changes the response of it. So just note that if that is specifically what you're looking for with an exercise test. All right, so what are some exercise programming recommendations? So, in general, light to moderate exercise, according to the basic CDD4 recommendations, are safe to do and they're good. So, those are a great place to start. Now, specifically for ICD, because most people who have an ICD have something like chronic heart failure, um, high intensity exercise is not recommended for this group. So just note that. Rigorous activities involving the upper extremity should be limited during the first 3 to 4 weeks after implantation, and this is just to let that incision heal. So if you do have a patient who comes to you, right after they get it, yeah, just, like any other procedure or surgery that someone may have had, just be careful with that region. Medication should be taken as prescribed and at least 3 hours before exercise. So that's similar to exercise testing. This is just in general for their training. And then each individual should be aware of their pacemaker or ICD heart rate thresholds. Now, it may be different because, as we talked about, at least for the pacemaker, um, yeah, everyone's algorithm is probably a little different. And depending on what their cardiologist does with that machine and what the pacemaker is relaying about the data it has, um, yeah, just every it's probably different for every single individual. So they should be aware of all of that. And then target heart rate can be determined from a maximal exercise test, but may not be necessary for all individuals. Um, so yeah, just take that as you will as the coach, right? Just individualizing everyone's plan. And then exercise heart rate should be kept 10 beats or more below the anti-tachycardia pacing or defibrillation threshold of the ICD. So again, hopefully they will know that and they will tell you so you can monitor that for them as they're exercising. But that's all we have. So again, it's a pretty short chapter. Only things that I kept out of this presentation are just the technical details of each type of pacemaker or ICD. So if you are curious about that, read the textbook and you'll get some good information. But other than that, I will see you in the next video for chapter 15.